And we are here with Dr. Carolyn Harraway-Smith, Cone Health's Chief Medical Officer for Women's Services. She's answering your questions about all things pandemic. This first text question says, how long do people stay in the hospital with COVID?
It really depends on how ill they are from the beginning. Remember, the majority of people who get COVID are not hospitalized, but if they are hospitalized, it's usually because they can't breathe well, or they get very sick, they have severe fevers. And so it really just depends. If somebody gets pneumonia and they have other medical conditions, it could be days or even weeks, unfortunately.
That's a scary thought. Okay, this person says, how will we know when it's safe to drop the restrictions?
You know, I don't think the average person, would know. I think this is where we rely on our experts and our healthcare professionals. We've got great infectious disease specialists who guide us. We have a whole host of people at Cone who do predictions based on the evidence around the country and what's happening in our community. And all of those things put together give us an idea of when to reduce those restrictions. And I think this is where relying on healthcare providers and experts who do this day in and day out is the best idea. If someone tries on their own to determine when to release those restrictions, you're probably going to be incorrect and probably not make the safest assessment for you and your family.
This person's wondering, if I just had COVID, is it likely that I could get it again, or have I built up some immunity?
So we certainly believe that if you have a natural infection that you do build up some immunity. The problem with natural immunity in the situation with COVID is it's not reliable. I've had a colleague who had a significant COVID infection, never had any evidence of immunity afterwards. And so even if someone has had a COVID vaccine, has had a COVID infection, we still recommend the vaccine because we've seen over time the reliability with the vaccine and also with the booster. So some immunity there, not necessarily reliable.
Gotcha. And kind of following up with that, is there a waiting period between having COVID and then getting vaxxed or boosted?
I'd have to get back to you because I think the answer is no, but you don't want to get a vaccine while you're acutely ill. So if you're ill at the time and you have symptoms, no. Following that, you can go ahead and get the vaccine. If you've gotten monoclonal antibodies though, and you have the vaccine, you will have to wait a significant amount of time.
If you get that infusion, you would have to wait some time. Okay.
Yes.
What about, we've been hearing so much when it comes to the vaccine and fertility. What can you tell us?
You know, we never believed as healthcare professionals that there was an interaction. And we have now hundreds of thousands of women who have received the vaccine, and there's no evidence that the vaccine creates any risk for infertility. In fact, recent studies came out on the father's end to see if there was paternal or infertility related to the male, and the answer there is no as well. So there have been lots of questions about that from the very beginning, and I followed that from the very beginning, and we have had no evidence to suggest that there's any decreased fertility in getting the vaccine.
All right.
And that's good news for women.
That is good news for women. Since we're on kind of the women track right here, what has been studied when it comes to like women's menstrual cycles and COVID vaccines or COVID itself?
That's another body of work that's been closely followed and studied. And the most recent data suggests that some women may have a delay of about half a day related to their cycles. But even with that half a day delay, and that's, again, the person who would note that is somebody who's really sensitive to their menstrual cycle. The average woman will not note any difference at all in her cycle.
Okay. This person is asking, why do I keep testing positive, even though it's like days and days or weeks and weeks out?
So I don't know the specific situation with that person. What I do know is this: when we test positive, positive, it takes weeks for the actual antibodies in our system to leave. And so, for example, if someone was scheduled for surgery and they had a known COVID infection, we would see them back and schedule them at the 2 week mark and not even test them because we know that they could still test positive, but that's not active infection. So that's not to be worried. So if you had COVID, had symptoms, and you waited, greater than 10 days and you're symptom free, that test can still be positive, but you are not still infectious. And so you don't need to keep testing.